Biron, the CEO and President of Northumberland Hills Health Centre, and Andy Oliver will be joining us thereafter. He's the Vice President of Fuel Services for Cameco. But first we're talking to Robert. Robert, nice to meet you. Welcome. Welcome to Northumberland, I guess.
Thank you very much.
Now, are you new to Northumberland?
Yes. Well, yes. I lived in Guelph and worked in Guelph for 10 years and grew up in Brantford, Ontario. So Cobourg is a new place of residency for myself and my wife. However, that said, I was quite familiar with Cobourg growing up. My grandmother lived here for quite a few years.
Oh, really?
And I've got a number of cousins that live in Cobourg and Port Hope as well. So familiar with the area growing up, and so I knew when the opportunity came up that was a great community to relocate to. So, how
are you finding the challenges of the move? Family getting acquainted and adjusting? You've been here since November, correct?
Since November, yeah. We moved in November, and well, it's been a long winter, to say the least, and work has certainly kept me quite occupied. But we're slowly getting settled and making connections to the community, and people have been very welcoming, and we look forward to continue to get more involved with the community. So,
well, we welcome you here. Obviously, you're taking on the big job left by Joan Ross at her retirement. Obviously, huge challenges at the hospital, not just maintaining services, but obviously maintaining levels of costs. What are you seeing as the biggest challenge right now for you as the new guy?
Well, I think you hit the nail on the head in terms of what the current issue for us is. It's certainly financial. And we're really not much different than many hospitals in the province. We're having to deal with an operating deficit that is quite substantial. And actually, this past week, or last week, our board approved phase 1 of our budget, and which saw we started off with a $2 million operating deficit, and through extensive teamwork and with our internal stakeholders, we've been able to reduce that deficit by $1.4 million. That still leaves us a gap of about $600,000, and so today actually we're launching phase 2 of that budget strategy, and that's to continue to look at operating efficiencies across the hospital. And if necessary, we need to start having a dialogue with our community around scope of services that we can provide in order to get to a balanced position. So those are that definitely is our immediate challenge, and I'm not sure if you have other specific questions as it relates to our strategies, but in essence,
you've already said you reduced the deficit by 1.6 million, I believe.
1.4 million.
1.4. Sorry.
Yes.
How did you manage to do that?
So in December, so I arrived in November, so shortly thereafter in December we launched what we've called the collaborative budget strategy that we coined shared challenge, shared solution. And the sharing part is intended to instill on the internal team to get involved and engage them, because I believe strongly that it's the people that are actually on the that do the work that are in the best position to come up with ideas and solutions. And so we launched that in December, and over the last 3 or 4 months the team has had their head down, and our management team as well has rolled up their sleeves, and we came up with cost-saving strategies that were pretty much across all services in the hospital, and administrative and support savings, savings relating to clinical efficiencies, and also some of the physician payments that we were making as well. So across all fronts, and everybody collaborated and participated in the solution, and we're not quite there yet, but I'm quite pleased with the teamwork that our team demonstrated over the last 3 or 4 months.
But still approximately $600,000. Now I understand you're going to be inviting the public now to come on board and talk to you. You mentioned that just a moment ago about strategies and services. And I think that's probably the biggest problem with healthcare, isn't it? Because everyone expects it to be for every single thing, and things are expensive, obviously. I mean, the MRI, the operation of the new MRI equipment, obviously that's going to be an expense that has to be borne by the general public as well. But really the strategy, I guess that needs to be determined is what are the primary services that people can absolutely not do without. And I guess that's what the public input is all about, isn't it?
Yes, exactly. That we haven't defined what we often refer to as core services. And our hospital is very fortunate to be able to provide a broad scope of services to our community. And in the event that we need to have to make some choices or prioritize those services, the exercise that we're embarking on is to have a dialogue with our community about those choices, and also the framework, the decision-making framework about what are the values or principles we want to apply to that decision-making process. It's not as easy as taking the list of services and picking the top three. It's as you can appreciate, there's a lot of complexity. There's a lot of individuals and perspectives that we want to bring to the table, and we wanted to get a good cross representation of the entire community that we serve. So in our case, our catchment area is West Northumberland, and so that goes to about on the east side to about Brighton, and to the west side towards Bowmanville, depending on where the residents go, and then north just south of Rice Lake. So it's a fairly large geography. And as you can appreciate, there's a diverse population. We want to make sure that we're not only engaging the educated and affluent population, but we understand that there's individuals. Actually, this morning I just had a presentation to the Poverty Reduction Committee, and to solicit their ideas and as to how we reach out to that community. So our intent is to be proactive, meaning that we want to start the process at the beginning of the dialogue, and rather than the management team and the board coming up with plans and then putting them out for input after the fact. It's been proven in other communities that doesn't work because people don't feel that they were engaged at the beginning of the process. We want to be as transparent and open as possible, and we also want to be inclusive as possible. So we're approaching it a little differently than other hospitals, and we hope to be successful. It is an enormous undertaking, but we think it's a valuable one as well.
Well, I want to remind the viewers you're watching TV Kojiko. This is Municipal Matters. I'm Dave Glover, and with me is Robert Biron, the new CEO and President of Northumberland Hills Health Center. Now, we're talking about public input. Part of that strategy, I understand, is to do so by telephone, by phoning the people in the area, I guess a telemarketing survey. But will there be town hall style meetings being set up in any of these areas?
Good question. So the intent of the telephone survey that we're launching mid to late April is really starting from a lower point or a starting point. And the starting point is asking the community how they wish to be engaged. We don't want to make assumptions that town halls, for example, would be the preferred way. We don't know. We've never asked. And some other communities have made the assumption that by using the media, for example, by sharing information, that's adequate community engagement. We feel differently, that we want to hear the ideas of our community about how they wish to be engaged. So the purpose of that survey, the telephone survey, is to focus on that question. How do they receive information about our hospital? But more importantly, as we start creating a structure around community engagement, we want to hear what is the best means of doing that? What are the mechanisms and channels that will allow us to reach out to as many people as we can? So to your example, the public may tell us there's a wide range of opportunities. It could be just strictly information sharing, where we work with the media to share our circumstances.
Like doing what we're doing right now.
Well, exactly, yes. And alternatively, it might be using web tools. There's a lot, as you know, there's new technologies that allow for engagement using the internet. It could be town halls. It could be community advisory committees or panels that report and provide guidance to the hospital board. And so there's a range of opportunities for engagement. Now, we can't afford to do all of those, and that's why the purpose of the survey is to ask that question: what are the mechanisms you would prefer to be engaged? And that will help us structure the right approach.